Well, good evening, everybody, and welcome to another edition of Question Lab. I am your host tonight, Jeff Downing, and I'm going to lead you through a set of questions related to your old friend, biochemistry. And to do this successfully, I'm going to lean on the talents of Dr. Paras Fakaria. Paras, would you like to introduce yourself to the crowd?
Sure, thank you, Jeff. Hey guys, my name is Paris. I am a dermatology resident currently here in Dallas, Texas. I originally graduated from pharmacy school and then subsequently went to medical school back in Michigan. I'm also an RX coach with USMLE-Rx, so I work one-on-one with students such as yourselves to help prepare you guys for the USMLE Step 1 and Step 2 CK as well. And I'm happy to help lead tonight's session.
We're going to talk a little bit about RX Coach later on, but we just want you to know that the method that we use in answering coaches during the RX Question Lab is quite similar to the methods that we use during our tutoring sessions. So keep that in mind. And our main goal here is to help you learn some of the methods that will help you succeed on test day, as well as covering some of the content. So with that being said, let's jump into question number one. One thing you're going to see, as a part of our approach is, when we, first launch the question, you don't see the answer choices, and that's by design. We don't want you to be, we don't want you to panic if you see a term or a disease or a drug in the answer choices that you don't know anything about. So we encourage you to cover up the answer choices and then go and read the lead-in, which is the actual question part of the item. So we ask you to read the lead-in, then we read the vignette, and then we'll read that lead-in once again. Okay. So now that you know a little bit about our process, let's get started. So again, the lead in here, the substrate of which of the following enzymes has likely accumulated in his lungs? Okay, think about that. Think about the kind of information you're going to want to collect from the vignette as we read the story. A 75-year-old man comes to the physician because of worsening shortness of breath and a chronic cough over the past 10 years. He has a 100-pack year history of cigarette smoking. So the question again, the substrate of which of the following enzymes has likely accumulated in his lungs? So think about that. Think to yourself how many steps you think it might take. If you want to, you can go down the question box and let us know if you have an answer to that in terms of, gosh, how many steps would it take for me to nail this one? And with that, I am going to turn it over to Paras. Paras?
Thank you, Jeff. So what we're going to do is we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. So starting off, generally they like to give you demographics for the clinical scenario. So in this case, it's a 75-year-old man. So you always want to make note of that because that's going to clue you in automatically as to what kind of things you should have on your differential diagnosis, okay? Then they usually tell you, why are they coming to the doctor? Why are they coming to the ER? And in this case, it's because of worsening shortness of breath and a cough. So you want to make note of the presenting signs and symptoms that brought them in to be seen. And then also, just like this question, a lot of times they'll tell you how long has it been going on for? Is it acute, like a few minutes, or is it chronic, like this patient, where it's been going on for the past 10 years? We also are given a little bit more information about social history, okay? And we know this is a biochemistry question because it's asking us about an enzyme and a substrate, okay? So by reading that lead-in, we automatically knew this was likely a biochemical question. So this question is specifically asking us about a substrate that is accumulated in his lungs, but not necessarily the substrate. They're asking about the enzyme. So I think we've got a couple steps here. I think one, we've got to figure out what may have be accumulating in this patient's lungs. What is that substrate? And then what enzyme is that a substrate for? So that's step number 2. So figuring out what is accumulating in the lungs, and then what is that an enzyme, or what enzyme is that a substrate for? Step number 2. So what we'll do is we'll go ahead and take a look at those answer choices. And what we recommend is when you're going through answer choices, we recommend starting at the bottom and working your way up to the top. So starting with answer choice E and working your way up to answer choice A. And the reason we recommend this is because a lot of times we'll see students who they'll start at the top, they'll see something they'll like, and they'll select it without having gone through all the choices. So sometimes they'll get that question wrong because they did that. So we recommend doing it this way to make sure you don't make that mistake and prevent yourself from biasing yourselves. So let's go ahead and go through those answer choices one at a time. Answer choice E, sodium potassium ATPase. D, sodium proton exchanger. C, NADPH oxidase. B, cyclin-dependent kinases. And A, carbonic anhydrase. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer here, and we'll talk about it in just a few seconds.
Excellent, thank you, Paris. So we're kicking it off with a couple. It's a two-stepper. So go in and take your best shot. What do you think? What do you think the enzyme is that is accumulating in this gentleman's lungs? Let's see, let's see, a little over a third of you had voted. Let's see the votes pouring in. We always remind you that you never want to leave a question unanswered on test day. You're not penalized for incorrect questions or incorrect responses on USMLE. So every block, all 40 questions you need to answer them. Same thing goes with question lab. So make sure you don't leave any of these questions unanswered. Okay, almost 70% of you have voted. So I'm going to give you just a few more seconds and we're going to close the poll. Okay, 3, 2, 1. Get that vote in. Okay, we're going to close the poll and share the results. So let's see. Over half of you went with carbonic anhydrase. Almost about a quarter of you went with NADPH oxidase. So looks like we've got a clear favorite. Let's see if you guys are right. And the answer is answer choice A, carbonic anhydrase. Good job, everybody. If you didn't get it right this time, listen up. Paris is going to walk you through it.
Thank you, Jeff. Yes, great job, guys. So I think you guys picked up on what's going on, but we know that this patient is a chronic smoker, okay? And he likely has COPD because of that. He's got a chronic cough and shortness of breath for essentially a decade, okay? Now, in these patients with COPD, we know that these patients often retain CO2, okay? And that's because these patients have ineffective respirations and they have air trapping in their lungs. So these patients often retain CO2. So now that we've determined what is the substrate that is accumulated, CO2, which of those enzymes is it a substrate for? And of those answer choices, the best answer choice there is answer choice A. If we take a look at the next slide, this is looking over carbon dioxide transport in the human body. So CO2 is transported a few different ways, okay? CO2 can be dissolved, CO2 can be bound to hemoglobin, and most commonly, CO2 can get converted to bicarbonate, and that's via carbonic anhydrase, okay? So bicarbonate, or sorry, CO2 and water with the carbonic anhydrase enzyme can get converted to H2CO3, which can then become bicarbonate. Okay. So then you can see there how CO2 is a substrate for carbonic anhydrase. Okay. If we go back to the other answer choices on the original question, you'll see that CO2 is not really a substrate for those enzymes. Okay. Sodium, potassium, ATPase, as you can imagine, its substrates are sodium and potassium. Answer choice D, sodium proton exchanger, its substrates are sodium and protons. Okay. NADPH oxidase, this is used by phagocytes, and that's to convert molecular oxygen into superoxide and other oxygen radicals. So oxygen is the substrate of NADPH oxidase. In patients with COPD, if anything, this patient would have a harder time oxygenating. Answer choice B, cyclin-dependent kinases. These are enzymes that are important in regulating the cell cycle. Okay. And so these enzymes have more to do with cell cycle progression rather than CO2 being a substrate for them. So the best answer choice here, like you guys picked, is answer choice A.
Excellent. Thank you, Paris. So great job, everybody. Looks like a lot of you had it nailed, and hopefully everyone else learned something along the way. So good job. Let's carry that momentum forward into question number 2. Okay, so once again, we're going to start with the lead-in. Which of the following is the most likely mechanism of this patient's condition? Which of the following is the most likely mechanism of this patient's condition? Think about what kind of data you want to draw from the vignette as we read it. A 19-year-old woman comes to the clinic because of new onset reddish-brown urine. Symptoms began after she started taking trimethoprim sulfamethazine 2 days ago for a urinary tract infection. Laboratory studies show hemoglobin is now 10.8, down from 13.5 at her visit 2 days ago. So again, the question, which of the following is the most likely mechanism of this patient's condition? Think how many steps you'll need to answer that one. Put it in the question box if you'd like, as we turn it over to Paris. Paris?
Thank you, Jeff. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. So now we've got a much younger patient, a 19-year-old woman. So that's obviously a big change, and you want to make note of that, particularly as you can see in the next sentence. Okay, there's some important clues there. Now she comes to be seen because of new onset red-brown urine. Okay, so definitely abnormal. That's the presenting sign. Okay. We are given some important medical and medication history and also some laboratory values. So you want to make note of that, especially when there is a change in laboratory values from baseline. You want to know what their baseline value is, and then you want to know what it is currently. Okay. So this question is asking us about the most likely mechanism of the patient's condition. So I think we have a two-step question here. I think one, we've got to figure out what is this patient's condition, what is going on here, and then two, what is the most likely mechanism of that condition? So a nice two-step question here. So once again, we're going to go ahead and look at those answer choices. We're going to start at the bottom, and we're going to work our way up to the top. Answer choice E, X chromosome inactivation. D, loss of heterozygosity. C, incomplete penetrance. B, gonadal mosaicism. And A, gene amplification. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer here, and we'll talk about it in just a few seconds.
Okay, excellent. Thank you, Paris. The poll has been launched. What do you think is the most likely mechanism of this patient's condition? Got all of your answer choices there, so think deeply and answer promptly. Okay, it looks like you guys are thinking through this one. A little bit more information that you need to pull down. Kind of thinking about, well, what about that? About the age of the patient? What about those urine findings? What about her symptoms and when they started? What about that medication? What about that hemoglobin? Anyway, lots to consider. Let's see how everyone's doing. Over half of you have voted. We've got a pretty good mix so far. So it looks like opinions vary regarding the that most likely that that key mechanism. Okay, I'm going to give you all another few seconds, and then we're going to close the poll. Okay, 5 seconds. Okay, everybody, take a shot, even if you're not sure about it. Go ahead and register your vote. Okay, great. Well, we've got over 3/4 of you vote. I'm going to close the poll, and we're going to share the results. So, fairly spread out. I mean, not many votes for gonadal mosaicism, but everything else got at least double digits, with X chromosome inactivation, the leading vote getter. So let's hide those results and share the answer. And the answer is E, X chromosome inactivation. Again, majority ruled on that one. So nice work, everybody. If you didn't get it right, we're going to let Pars walk us through this one. Pars?
Thank you, Jeff. Yeah, it's definitely a tougher question, as you could tell by that split, but nice job with this question as well. Okay, so let's take a look at what's going on. So this patient had some dark urine, which would hopefully clue you into an acute blood loss, specifically hemolytic anemia, okay? After starting trimethoprim sulfamethazine, which is a sulfa drug, okay? And we saw that hemoglobin dropped in a couple days. So we know that there is a little bit of anemia. And then hopefully we're picking up that it's hemolytic anemia based on the drug exposure and the change in urine color, okay? Now we know this was after beginning a sulfa drug. So hopefully you guys might have picked up that this was hemolytic anemia from a trigger potentially indicating G6PD, or glucose-6-phosphate dehydrogenase deficiency. Okay. So G6PD, it's the first enzyme in the pentose phosphate pathway, and red blood cells rely on that pathway. Okay. So in the setting of certain stressors, RBCs can be vulnerable to reactive oxygen species and lead to hemolysis. Okay. So if we take a look at the next slide, it talks about G6PD deficiency, okay? And it talks about how this is an X-linked recessive disorder, okay? So it is an X-linked recessive disorder. However, it can also present in females because remember, a lot of times that X chromosome, one of the two X chromosomes, is inactivated, okay? And it's the process by which in early embryogenesis, one of the X chromosomes in females is randomly inactivated. It becomes that bar body, okay? So in this patient, that X chromosome that was active or was normal had a mutated G6PD gene. That's why this female was able to likely develop G6PD deficiency. So her red blood cells are prone to hemolysis in the presence of oxidizing agents. And you can see there some of those oxidizing agents: favabine, sulfonamides, nitrofurantoin, some common causes of oxidizing stressors, okay? So if we go back to our question, hopefully you can see now why that's the best answer choice, why this female developed hemolytic anemia in the presence of an oxidizing stressor of a sulfa drug. Now the other answer choices, if you selected those, loss of heterozygosity, that would be more so in patients with inherited cancer syndromes, where you have a loss of a tumor suppressor gene, okay? And then, so a patient, let's say, had a mutated tumor suppressor gene on one of their alleles, and so they were heterozygous, and then they somehow lost their second allele, and that was mutated, so now they've lost that heterozygosity. And that's something we talk about with p53 and retinoblastoma genes. Answer choice C, incomplete penetrance. This refers to inherited diseases where not all people with the genotype display the associated phenotype, okay? That's not really what we're talking about here. Answer choice B, gonadal mosaicism. This is talking about where some of an individual's gametes contain a mutation, but not all of them. So depending on which gametes fuse together, you may or may not carry forward that mutation. So the gonadal cells, the gametes themselves, may or may not, they differ in terms of whether they carry the mutation or not. That's called gonadal mosaicism as opposed to somatic mosaicism. And lastly, gene amplification. This is talking about increasing the gene copy number and not really what's going on in this patient. So the best answer choice here, like you guys selected, is answer choice E.
Excellent. Thank you, Para. So again, good job, everybody. Complicated material here, perhaps for some of you. It's been a while, so these biochem reviews are always good at kind of stirring up hopefully some long-term memories, long-term storage knowledge, right? So anyway, good job. And I know it says that was question 3. That was actually question 2. So let's we're going to be getting ready for question 3. But before we do, just want to, again, remind you about RX Coach, which is the tutoring service brought to you by USMLE-Rx, which, of course, is created by those that create all the content for first aid for the USMLE Step 1. We like to start with you. We want to get to know you, and we do that in a couple of different ways. First, we have a free consult. So, when you sign up, we use that to learn a little bit more about your story and what your goals are. And then, if you think that this is the right approach for you, then we start with that 160 question assessment. So, it's a good assessment that it's broad, covers all of the areas there. In particular for step 1, and based on your results, we then help develop a personalized study plan with you. We are big proponents of that one-on-one approach. It's not going to be you're not going to have 7 or 8 other students with you. It's going to be you and one of your RX certified tutors. Could be a tutor like Brenda or Paris, or one of the many other RX coaches that are on our staff. And in addition to that, you do get access to the RX 360 Plus digital learning suite, which includes Step 1 QMax and RX Bricks. So it's a total package for you. And our goal is to meet you where you are and help you get to where you need to be. So if you would like to set up your free consult, we'll put it here in the chat box. Just go to rx-coach.com and you can go in there. It takes you about 30 seconds to set up that free consult, and we can work with you to help you get to where you need to be. Okay, with that, we're going to go into the second half of tonight's session and head into question number 3. Okay, so everybody, let's lean in, let's focus, and let's do our best. Okay, once again, we are going to start with the lead-in. Which of the following enzymes is most likely deficient in this patient? Another enzyme question for you. So think about the kind of information you're going to be looking for in the vignette. An 11-year-old boy is brought to his pediatrician by his mother because of recent episodes of lightheadedness, racing pulse, dizziness, and nausea. On physical examination, there is generalized decreased muscle tone, and the liver and spleen are palpated a few centimeters below the left costal margin. Laboratory studies show increased creatine kinase and decreased glucose levels. Urine ketones are positive with negative glucose. An electromyogram shows features of myopathy. So again, the question, which of the following enzymes is most likely deficient in this patient? Think about the number of steps it'll take to answer that one. Let us know in the question box as I turn it over to Paras. Paras?
Thank you, Jeff. So what we will do is we'll go ahead and show you what we think are the important clues in this vignette and the lead-in. So now we have a pediatric case, an 11-year-old boy, and he's being brought in by his mom because of a few signs and symptoms, lightheadedness, dizziness, racing pulse, and nausea. We're told about some important physical exam signs that are abnormal, as well as some lab studies, urine studies, and even an electromyogram, all of which have relevant findings. So you want to make note of those, you want to highlight those because that's going to help clue you in into the diagnosis here. Okay. So then they're asking us specifically about the most likely deficient enzyme. So I think we've got a few steps here. I think one, we've got to figure out what is the condition and that's this patient has. And then two, what is the deficient enzyme in that condition? So I think we have a nice two-step question here. So let's go ahead and take a look at those answer choices. And once again, we're going to start at the bottom and we're going to work our way up to the top. Answer choice E, myophosphorylase. D, lysosomal acid maltase. C, glucose 6-phosphatase. B, debranching enzyme. And A, branching enzyme. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here. We'll talk about it in just a few seconds.
Okay, that poll is launched. Let us know what you think the enzyme is that is most likely not in abundance in this patient. Again, these questions with the longer stems and a lot of information to parse. It's going to really one of the skills that you you need to develop, especially if you're just getting started. Maybe if this is like your first time, if you're just thinking about, well, what is USMLE like? This is a good example of the kind of question where you're having to pull in knowledge from different domains and apply it to a unique disposition. So let's see, almost getting close to 2/3 of you have voted. I know it's challenging, but go ahead and make a selection. Looking at the results so far, it looks like it's a pretty it's a tight race between three of the answer choices. So it'll be interesting to see how this turns out. Okay, 2/3 of you have voted. I'm going to give you another maybe another 5 seconds. So get your answer in. Again, there's no penalty for guessing on your board exam. So don't leave any question unanswered. Okay, with that, I'm going to go ahead and we're going to close the poll. And share the results. And so it looks like, again, pretty much of a 3-horse race. More of you thought debranching enzyme is the enzyme, with myophosphorylase in second place and glucose 6-phosphatase in third. Interesting. Let's go ahead and hide the results and see what the answer is. And the answer is answer choice B, debranching enzyme. Once again, the leading vote getter is correct. If you didn't get it, that's okay. I mean, obviously, a lot of you didn't get this one right. It's not to worry. This is the time to get the answer wrong, right? If you're going to get it wrong during question lab. We're going to let Paris walk you through this one. Paris.
Thank you, Jeff. So definitely a tougher question. Okay. Now we know that there's a few things going on here, right? There's decreased muscle tone. Okay. There is elevated muscle enzymes of creatine kinase. Okay, so definitely something going on involving muscle. We also know that there is decreased glucose levels. Okay, so that's not good. So we know that this patient maybe has an issue with making glucose or gluconeogenesis. Okay, and then this patient also likely has hepatosplenomegaly. So if you put those clues together, along with the myopathy and the other things, you could hone in on a glycogen storage disorder, okay? Because this patient is not making glucose. This patient has muscle issues as well, okay? So likely a glycogen storage disorder. And within that, you can tell, based on the answer choices, that's what they're getting at. But within that, what is most likely? Okay, so that's when we've got to use the clues that we pick up on to get to that answer choice. So we know this patient has hepatosplenomegaly, low muscle tone, and elevated creatine kinase. Okay, so this is probably getting at Corey's disease. Okay, now unfortunately the table from first aid didn't get translated into this PowerPoint, so I apologize for that, but I'll do my best to explain it, okay? So Corey's disease is similar to von Gierke's disease, okay? Von Gierke's disease is more severe, and Corey's disease is a little bit milder, okay? And so one of the ways to help understand it is to kind of realize what von Gierke's disease is. And von Gierke's disease is where you have a severe fasting hypoglycemia. Okay, again, you cannot make glucose. You can also have hepatomegaly, okay? But one of the things you would expect to see in von Gierke's, because it's so severe, is an elevated lactic acid level, okay? We were not told about an elevated lactic acid level here in this case, okay? And we were also told more about hypotonia and muscle issues, which is a little bit more consistent with Corey's disease. And that isn't the defect in Corey's disease is debranching enzyme. Okay. Now, the other answer choices, those would be myophosphorylase. I know a lot of you guys selected that. That would be McArdle's disease. And with McArdle's disease, yes, you do have muscle issues. You have muscle cramps, but that's usually on exertion, muscle issues with exertion and fatigue. And I would also expect to see myoglobin in the urine, which we're not told about, okay? Answer choice D, lysosomal acid maltase, that's talking about Pompei's disease, okay? Pompei's disease is also a glycogen storage disorder, but usually you see more cardiac issues, cardiomyopathy. And we're not really told about that in this question. Answer choice C, that would be getting at von Gierke's disease. Okay? So not only would I expect to see elevated lactic acid, but I would also want to see maybe an elevated uric acid, elevated triglycerides, none of which are told to us. And on top of that, I would want a severe fasting hypoglycemia. Okay? They're not specifically told the blood sugar levels here, so that makes that a little bit tougher. That's probably the closest answer choice, the next best answer choice here. And then lastly, answer choice A, that's getting at Anderson's disease. These patients also can have hepatosplenomegaly, but would also have cardiac issues like cardiomyopathy and wouldn't have as much of the other signs and symptoms that this patient has. So this is definitely a tougher, one of the tougher glycogen storage disorders questions, but it's important then to keep in mind what helps differentiate them. That's a good example of this in this question.
Okay, thank you, Paris. Thanks for that breakdown. Again, think about all of those things that you should be looking for those particular enzymes, as well as thinking about it from the disease standpoint. So, nice job, everybody. That sets us up here as we get to our final question for the night. Hopefully, everyone is tuned up and ready to perform well on this one. Question number 4. We'll start with the lead-in. Which of the following mechanisms best characterizes this patient's most likely diagnosis? Think about that as we read the stem. A 4-year-old boy is brought to the emergency department for knee pain and swelling after a minor fall while running one day ago. He has a history of easy bruising and recurrent skin and respiratory infections. Temperature is 38.3. On physical examination, his right knee is warm and tender on palpation. He has very fair skin, white hair, and light-colored irises. So again, the lead-in. Which of the following mechanisms best characterizes this patient's most likely diagnosis? Think about the steps here. This is an interesting one. Looking at that phrase, best characterizes and most likely diagnosis should be an interesting one. With that, I'm going to hand it over to Paris.
Thank you, Jeff. Yes, definitely an interesting vignette here. So this is our 4th time kind of showing you, what we think are the important clues in a question. And so hopefully, as you guys are going through these biochemistry questions, you're able to pick up after going through this on those important clues and subtle clues, things you should be looking for, things that are missing as well, that can help narrow down your differential diagnosis and get to the right answer. Okay. So in this case, we're told about a 4-year-old boy. And again, we're told about his presenting signs and symptoms. We're told that happened just a day ago, the knee pain and swelling, but we are told about some other past medical history. Okay, very important here. And then we're told about he has a temperature, he has an elevated temperature, but then also some cutaneous manifestations, which I personally love. And obviously, that differential, the fair skin, white hair differential, is a very tough differential. Okay, so they're asking us about the mechanism that best characterizes the most likely diagnosis. So again, as you guys probably are guessing, this is a 2-step question. What's the most likely diagnosis, and what is the mechanism of this diagnosis? So let's go ahead and let's take a look at those answer choices. And once again, we've got 5 answer choices, and once again, we're going to start at the bottom and work our way up to the top. Answer choice E, tyrosinase deficiency. D, phenylalanine hydroxylase deficiency. C, mutation of the X chromosome. B, microtubule dysfunction. And A, autoimmune destruction of melanocytes. So once again, we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer here. We'll talk about it in just a few seconds.
Okay, excellent. Again, this is our last question of the night. Just as a reminder, we will be holding a raffle at the end of the evening. One of you will be the lucky recipient of a subscription to RX 360 Plus. So make sure you hang on if you want to participate. You don't have to do anything above and beyond what just showing up, but you do have to be present in order to win. So let's see. We've got nearly half of you have voted so far. So I want everybody here to close strong. Really kind of think through this one. There's again a lot of interesting information that you're provided about this particular pediatric patient. Okay, let's see. Almost 2/3 of you voted, so go ahead and get your vote in. What do you think the answer is? Okay, with that, I'm going to close it in 5 seconds. Okay, here we go. We're going to close the poll. And I'm going to share the results. Again, kind of an interesting spread. Tyrosinase deficiency was the big vote getter. Microtubule dysfunction came in second, but everything received double digits in terms of votes. So let's see what the answer is. I'm going to hide the results. Back to our presentation. And the answer is answer choice B, microtubule dysfunction. First time tonight that the leading vote getter was not the correct answer. So I'm going to need a little remediation here. So Paris, walk us through this one.
Yes, absolutely, Jeff. Definitely a tougher question here. Okay. So as we talked about, this differential in patients with very fair skin, white hair, and light-colored irises is tough. Okay. The key things here are we know this patient has a history of recurrent infections. Okay. So we might want to be thinking about immunodeficiency. Okay. And on top of that, easy bruising. So maybe some hematologic abnormalities with that. Okay. So this patient likely has Chidiac-Higashi syndrome. Patients have easy bruising, recurrent infections, and they also have a form of oculocutaneous albinism. Okay. So if we take a look at the next slide, this is looking at that immunodeficiency table in first aid. This is talking about that syndrome. And this is a defect in microtubule function. Okay. These patients have albinism or oculocutaneous albinism most commonly, recurrent infections. These patients also have coagulation defects and issues with platelets, and that's because these cells and these platelets have issues moving their granules around because of the microtubule defect. Okay. So they get these giant granules in their cells and their granulocytes and their platelets. So they have a little bit of bleeding disorder. Okay. So hopefully now you can see why this patient, if we go back to the answer choices, how this patient likely has that condition and why answer choice B is the best answer. Okay. So remember, granulocytes and platelets and melanocytes are affected in this condition. Tyrosinase deficiency, answer choice E. This is talking specifically about just oculocutaneous albinism without those other issues of immunodeficiency and hematologic abnormalities. So probably not E. Answer choice D. This is talking about in patients with phenylalanine hydroxylase deficiency, you can have decreased skin pigmentation, but you would also have a musty body odor, intellectual disability, seizures, nothing of that note in this patient. Answer choice C could be getting at Fragile X syndrome, for example, not really consistent with what this patient has. And then lastly, answer choice A, that would be getting at vitiligo, where you have autoimmune destruction of melanocytes that leads to depigmentation of your skin. Okay? Not so much issues with white hair and light-colored irises. And on top of that, we wouldn't really see recurrent infections with that. So the best answer choice here is B, after picking up on those subtle clues in that vignette. So great job overall tonight, guys. I'll pass it back to you, Jeff.
Yes, thank you, Paris, and yeah, great job tonight. A good showing by all of you. Uh, Main thing for me is that that so many of you were engaged. Most of you were answering the questions, and a lot of you doing really well. So again, nice job. Um, if you want to review any of those questions, here are the question IDs. So what you can actually do is, if you've got a USMLE-Rx subscription, you can just type these IDs into RX search and review them on your own.